Hi, I'm Joanne. Let's talk about treatment scheduling for pediatric patients. Of course, we all learn from our own different experiences, but I just thought I would share with you some things that really helped me. First, though, let's understand why babies cry, because although we might think we know, sometimes we don't know all the reasons why. They are trying to communicate something and get their basic needs met. Yes. But a baby without health problems will typically only cry for key reasons, and these are called the now needs. Now needs are hunger or thirst, pain or discomfort, like gas or being wet or sitting in a dirty diaper, feeling too hot or too cold, or having some positional soreness. Uh, Three, emotional reasons like loneliness, boredom, tiredness, or fear. And then a fourth reason is illness or feeling unwell. So, we really can't help but feel for those parents who are trying to satisfy the now needs but aren't able to. And when this happens, it's great that they can find someone like us to help figure out what the problem is with the baby. And why am I talking about crying right now? Well, first, when the baby's now needs aren't met, they show the signs of distress like crying and screaming, fidgeting, grunting, whining, and flailing about with frantic motions. And if we can recognize the beginnings of these expressions in our treatments run a lot smoother. So, back to scheduling. How do we know how often to schedule a baby in for a treatment? Well, it depends on what is going on with them, but let me just say at the outset, and actually similarly to adults, in most cases, we want to see a baby weekly until we feel satisfied with our changes and mom reports continual improvement or resolution of the baby's symptoms. Next, I like to see a baby biweekly, definitely under the following circumstances. One, when the baby isn't nursing properly, especially when not gaining weight or if they're losing weight. And two, when the baby's constipated and not pooping within 2 to 3 days from the previous bowel movement. I do bi-weekly treatments in other instances, but those are harder to define. Sometimes I don't feel that I was able to figure out a complex series of problems. Sometimes I've resolved some issues for the baby objectively from my view, but parents contact me to report there's been little change in the baby's displaying of agitation and crying or whatever it is. So I book them in again as soon as I can to resume my search. But going back to that first one, nursing problems, we have to get the baby suckling properly so they don't lose weight and so mom is comfortable. Because all kinds of problems start to result from poor latching and poor nursing, poor suckling, like fussiness, spitting up, agitation, reflux, air intake, resulting in gas, poor sleep, the list goes on. And at the same time, mom can be having cracked and bleeding nipples from poor latch and problematic suckling. Since babies nurse several times per day, we have to get on this problem and we have to prevent mom from getting sores, which could lead to mastitis and then a round of antibiotics and possibly deterring her from breastfeeding. If you're unsure what to do for babies with latching problems, please take the tethered oral tissues course that you'll see on this website. You'll learn explicitly how oral function is dictated by the compressions through the cranial plates and the cervicals, how tugs on the hyoid chain from shoulder problems and upper thorax problems need to be addressed. You'll learn things to avoid doing on a baby's special anatomical skull structure. And also you'll learn what an actual real physical tethered tissue is. And this will help you know whether the family should see a release provider like a dentist and which one you should trust and why. So let's move on to that second problem I like to see with babies for biweekly, constipation. It's a cyclical problem where the baby stool can get too hard and become a physical plug. And despite the ability for the colon to regulate proper peristalsis, and if the baby hasn't had a movement within 2 days after treatment, I like to book them in again as soon as I can to do a short check, gentle treatment more before things get out of control. And occasionally a medical doctor will tell the parents to use a suppository. And this is a good idea for them to try when they get home after a treatment to encourage the dried plug of stool to shift and get the results we all want for the baby. But sometimes osteopathic treatment does that for us. And hey, if they don't need to use a suppository after all, that's awesome. Now, I can explain some treatment durations for you that I find work well. For me, normally I book a 45 to 60-minute appointment for a new baby. And if you think that sounds long, it really isn't, because it takes time to get the whole birth story from the mom, to build the picture of the mechanism of injury in relation to the strains of the baby's birth. And you're assessing and treating a wriggly little baby, a moving target, right? And the baby also needs some breaks from your hands and some attention from mom. And especially as soon as you start seeing those signs of crying and fidgeting and they seem tired, they just need a break, let them have a cuddle. And then you can resume your treatment. Then you haven't lost your control of the situation by letting the baby's emotions escalate. And the added benefit to starting and stopping is you're kind of letting treatment settle into the body while the baby's right there in the office with you. Now, about follow-up appointments, I like to book 30 to 45-minute sessions, and I choose depending on the baby's sort of personality. If they're quieter and seem calmer and the problems aren't so intense, 30 minutes seems like it's enough. Conversely, baby comes in really agitated on that first treatment and they just seem like they have a lot going on and they're quite a puzzle to figure out. I like to explain to the parents that I'd rather have more time than not enough for the next one, so I book 45. Some follow-ups can also be super short, and sometimes I do book a 15 to 20-minute treatment, and it can be all I need to just tidy up a few more things and ensure that the family has a good week or that they can span over the weekend into the next week. I just make sure that there's proper mouth biomechanics, resolution to colon function for timely bowel movements, so they don't plug up again, and that the baby stays pain and irritation free. And let me just make a note about more chronic problems or problems that are going to sit longer term in a baby that, that require some ongoing care. A perfect example is plagiocephaly. So that's flattening of a certain spot on the head as a resultant of the baby lying too much on that part of the head. And certain things like that, when a baby hits growth spurts, babies tend to regress in some areas of their bodies when they hit a growth spurt. So I like to see babies just before the onset of a growth spurt to make sure that there's good motion in the areas that I've treated previously in the past, so that there's forward progression through the growth spurt and nothing kind of find its way back to the original problem while they're going through all those changes in the other avenues of what's going on in their body. And growth spurts, the key ones especially, are the 2-month, 4-month, 6, 9, and 12. So I hope all of this advice helps, and I hope everybody has a great day.